lie on your backs, please. And begin feeling your connection to the floor. And particularly, just begin comparing, noticing differences between your right and left sides. Feel the weight of your right arm and the weight of your left arm, and the length of each arm. And just kind of notice, if you were going to pick one arm up, which arm would you automatically choose to lift in the air? And why? Just be curious. Notice the weight of your legs, each leg. Does one leg feel heavier because there's more contact? Or are there different sensations that give you that sense of weightedness through one leg more than the other? And what about the weight through your heels, the back of your heels? And notice the length of each of your legs. And if you were going to kick one leg up in the air, which leg might you kick up? And then roll on to your left sides, please. And bend your knees so that they're at about a 90-degree angle, and your hips so they're at about 90 degrees. Rest your right arm in any way that's comfortable for you. And really get a sense of the contact, how the right leg is supported by the left leg. Is there most of your weight through your thighs, through your knees? What part of your bottom leg supports the calf? How does your foot rest on your lower foot? How does this configuration lying on your side influence your pelvis and your trunk? How the left side of your trunk might be dipping down to rest on the floor. The weight on the floor through your left shoulder. And then bring your attention back down to your right foot. And just gently make sure your right foot is really resting in a even fashion on top of your left foot. So your heels are touching and the forefoot is touching. And just gently press your right heel down into your left heel. Just very gently. Just pressing and releasing, pressing and releasing. And next time you press your right heel down into your left heel, let your toes come up towards the ceiling. So you're pivoting the front of your foot up and then resting it back down. And notice what moves. Your foot is moving up in the air, but there's a rotational component happening in your lower leg. As you pivot on your heel and raise your toes up towards the ceiling. See if you can keep your knees together and just make it a soft, gentle movement. And feel that rotational component beginning to move up your lower leg. Can you feel any influences through your knee and even up into your thigh? And imagine the bones in that lower leg. Your main shin bone is your tibia. There's a little bone along the outside called your fibula. Just imagine how they're rolling in your skin as you raise your toes up and down, and rest fully each time. And then shift your attention so that you're pivoting on the ball of your right foot, touching your left foot, and raising your heel up to the ceiling. And lowering it. And noticing how this is different. Is it easier or harder? Does your leg feel lighter or heavier? Go slow enough so you can really feel how smooth is the motion. Do you move smoothly up and smoothly down, or do you lift your foot up and then it's there, and you lower it down and then it's there, sort of passing through the whole process of how you got there? See if you can linger a little in the process of raising and lowering and following the sensations of the rotation of your shin bones up and through your knee to your thigh, and maybe you might even feel it up into your hip. And just pause for a moment. And again, notice how your right leg is being supported by your left leg. Now that we've done just a few simple movements, are you letting more of the weight of your right leg be supported by your left leg? Or are you tending to hold it away a little more? And then bring your attention again to your whole foot, the whole of the right foot, and where your knees are touching, gently press your right knee down into your left knee a couple of times, just really feeling what's that contact like? What's that connection? As you press your right knee into your left knee, do you begin to take the weight off other parts of your leg? Typically, if something is pressing down, something else is lifting up. And if you were to continue to expand this part of the experiment, pressing your right knee into your left knee, what might begin to lift up into the air? As your knee presses down, can you begin to allow your right foot to smoothly float up towards the ceiling and float back down to rest again on the foot below? And notice this time where the rotational motion is happening. When you were moving the parts of your foot up and down, we were getting a rotation through your lower leg, your tibia and your fibula. And even though it's your lower leg that's raising and lowering, where's the rotational movement occurring? What joint is rolling in its sockets? What part of your skeleton is rolling beneath the skin? And as you connect with your thigh bone, your femur rolling, connecting into the socket, into the pelvis, how does the simple movement of raising and lowering your lower leg influence your pelvis, your spine? Can you feel any movement up into your ribs and even your shoulders on the right side each time you raise and lower your right lower leg? And then rest again. Begin pressing your right foot, the inside of your right foot, into the inside of your left foot. And each time you press and release, just let that connection grow, that point of pivoting that point of stability, connecting up through your lower leg, through your thigh, into your hip socket, till eventually you can float your knee up towards the ceiling. Each time you press, allowing the movement to grow just a little bigger, noticing more aspects where you put more of the weight through your foot. Is there more weight pivoting through heel to heel or the ball of your foot? Can you have a sense of the sole of your foot, the plane, and as you lift your knee up, it's tipping. If I were to put a book on the sole of your foot, as you raise your knee towards the ceiling, that book would tilt towards its side. And how does this influence the hip joint into the pelvis? As you lift your knee up towards the ceiling, does your pelvis roll a little backwards or a little forwards? And through these small movements, how does your pelvis speak to your low back, your spine, your ribs? And then next time you're raising your knee up towards the ceiling, keep going, up and up. Pretty soon it'll be going out and out to the side. And see if you can just let your whole body follow until you roll onto your back for a full rest. Notice the influence on your body. Feel the sensations of your right leg, the leg that's been moving in a variety of ways, up and down towards the ceiling. And the influence on your left leg, the leg that's been supporting you. How does that influence continue through your low back, the right and left sides, the back of your ribs and shoulder blades, sometimes people can even feel influences in their face muscles from their focus being on one side of their body. The tone begins to change as the nervous system is stimulated on that side. And roll again onto your left sides, please. Same configuration. And just a couple of times alternate between pivoting on your heel and lifting your toes up towards the ceiling. And how do you pass through that movement, pivoting on the ball of the foot, lifting the heel up towards the ceiling? Feel the lower leg rotating. And as you raise the toes and the heels, and you feel the pressure on the opposite side, or the opposite end of your foot, notice what else presses into the floor. So your foot presses into your other foot, but is there anything about your left leg pressing into the floor to support still further this raising and lowering of the parts of your feet? And then just pause for a moment. Bring your attention to the movements that we did previously with your whole lower leg. Feel how your knee is supported by your left knee. Feel that point where you will pivot. Feel how your foot is supported by your lower foot and how it'll be supported. And then slowly, starting with a very small movement, begin alternating, raising the foot, lowering the foot, raising the knee, lowering the knee. And notice in your attention, do you bring more attention to the raising of the knee and the foot? Is your attention different than the kind of attention you give in how you lower your knee back down to rest, and how you lower your foot back down to rest? Alternating one and then the other. And noticing here also, how do you use your left leg into the floor? Each time you raise a part of your foot or raise your knee, is there some sort of stability happening through that lower leg? On one hand, we could say so far this lesson has been about mobility of the right side. But you could also say this lesson has been about the stability of the left side. How does your left side give you that stability so you can free the right side for movement? Each time you rest your knee and your foot down, do you fully rest it, or are you already being compelled to the next part of the movement? And feel the gentle sway of your pelvis. Feel it moving back a little bit as your knee raises towards the ceiling. Feel it rolling a little forward as you raise your foot towards the ceiling. Which movement contributes to more length on your right side? Which movement allows your pelvis and your shoulders, the right side of your pelvis and your right shoulder to get a little closer to each other or to lengthen away from each other? And see if you can exaggerate that a little bit, depending on how you have that sensation, where maybe you intentionally take your shoulder a little bit away, open the side of your ribs. In fact, just try that as you raise your knee towards the ceiling. Bring a little more movement from your chest and your shoulders, letting your right shoulder open up and back a little bit. And then as you come forward and you rest your right knee again on your left knee and raise your foot towards the ceiling, let your right shoulder also come a little forward and down towards your pelvis. Feel the shortening of that right side and the lengthening of that right side. And bring your right leg fully to rest on your left leg and just pause for a moment. Pause in the sensations. Pause in your ability to attend to yourself and the frequent or occasional drifting of the mind into thoughts of this or that, and compassionately bringing yourself back to the attention of yourself, the care of your body, and ultimately the care of your soul by learning to listen. And then bring your sensation awareness to the whole of your left leg. The outside of your left thigh, the outside of your left knee, the outside of your left lower leg, and the outside of your left foot. And begin pressing that whole leg gently down and releasing it. And feeling, what does that take in yourself to press your left leg into the floor and release it? And do you put more pressure through the thigh and the knee? Do you forget a little bit about the lower leg and the foot? What if you were to try to evenly disperse the pressure through the whole of the left lower leg and the thigh? And then combine that with the intention not so much of lifting your whole right leg, foot and knee simultaneously, but of through the pressure, through the stability and support of the left lower leg, see if you can find a very graceful and effortless way to sense your right leg floating up towards the ceiling. So just the right leg, knee and foot together, so not pivoting any longer, but feeling the connection and pressing down of the left leg and letting the right leg just begin to float up towards the ceiling. And you may find that it's easier to first unweight the knee and then the foot, or to first unweight the foot and then let the knee follow to get that whole leg up in the air. Notice at what point might you try to effort. Can you continue a smooth and even breath, a full inhalation and exhalation, while lifting the weight of your right leg in the air? And how does the rest of your body participate? Or maybe it resists a little bit. How does your pelvis want to roll as your leg lifts and lowers? What happens in your ribs and your shoulder? And you begin to get a sense of your whole body beginning to roll towards your back. And again, where is your attention? Do you bring more of yourself to the sensations of lifting your leg up towards the ceiling? Or can you bring equal interest and curiosity to the functions of movement as you lower your leg and place it back upon your left leg? What's it like for your knee and your foot to touch again the place of support and rest into that support? In a culture where it's more about going and getting there than being here, how do you discover those sensations in your own being? And again, next time you're lifting your right leg up towards the ceiling, just keep going and going and going until your leg helps the rest of yourself find its way onto your back. And notice the sensations now, lying here on your back. Is it a good time to take a brain break from all this self-attending? Or is it even more interesting to feel the differences that have been accentuated between the left and right sides? Feel the length of your legs, the weight of your legs. Feel the influence up into your lower back, the right side of your ribs and the left side. The back of your shoulders. And then roll yourselves onto your right side, please. And just feel how you relate to the floor on your right side compared to the left side. Feel the contacts that your right leg, the thigh, the lower leg, your waist, your ribs, your shoulder makes. How familiar is this side? Is this the side you sleep on? Because we've spent so much time on your other side, does this side just feel less familiar? And just gently begin to press parts of your right leg down into the floor. Just really make a connection. When we're standing, we think about grounding, and quite a few people these days can immediately evoke some kind of image of sending some kind of grounding, an energy or roots or some visualization they practiced into the earth. But what's it like when you're lying on your side to ground your thigh, your lower leg, your foot into the ground, to ground your ribs and your right shoulder, the right side of your face? And then begin to imagine any of the movements that we did with your foot, your knee, your pelvis, your ribs and shoulder that we did on your other side. And in your own way, very slowly begin to practice, and once in a while play with, are you going for a movement? Are you staying in the moment-to-moment experience of how you process through that movement and how it influences other parts of your body? So notice if you've been paying attention more to the lifting of a limb, or the part of your left leg that's pressing down into your right leg. Notice your attention to the lifting and the lowering to different parts of your right leg. And what of your attention to what's happening to your skeleton? What's happening as your thigh bone rolls in your pelvis, that hip socket, and the movement talks to your pelvis, which talks to your spine, which in small or large ways influences your ribs, your shoulder, your breath. Whatever movement you're exploring right now, how small can you make that movement? Can you lift, if it's your knee or your foot or a part of your foot? Can you do everything to unweight that part of your left leg without actually creating any space between your left and right leg? All the preparatory movements without actually having movement happen. And then releasing all those preparatory movements. It's almost as if you begin to float the bones up a little bit in your skin without letting your skin ever lift off of your right leg or foot. And then grow the movement a little bigger. feel more space between your knees or your feet. Make it a little bigger and a little bigger until it's really clear how the movements are influencing you all the way up into your pelvis. Let yourself exaggerate what's happening in your pelvis to really assist the movement in your leg. See if you can bring more attention to what's happening in your ribs or your shoulder to help the pelvis, to help the leg lift more lightly in some way. And maybe little by little you can begin just floating your leg up in the air and playing with the different movements while the whole leg is airborne. What's it like to do the rotation in your pelvis with your knee and foot going up but without pivoting on something below you? What would it be like if your leg were just swaying in the breeze like everything was yesterday? If you do the movements with your whole leg floating, does that require more from your pelvis? Does it require more support through the outside of your right leg and foot? Does it change the support through your right side, through your right shoulder and arm? And what if there was music playing and your leg just started taking off on its own? A little up, a little down, a little forward, a little back. Like a child on the floor, discovering it can move. Discovering it's got a leg. Discovering sensations in the hip and in the foot, in the ribs and in the back, with no words for them, just the feelings and the sensations, the enjoyment of being here, now, in this body, in this room, on this floor, with this opportunity to experience this variety. And allowing this variety to enhance and expand life. Rest your leg back down one last time. And as lightly as possible, gracefully, effortlessly, letting your breath be full and smooth. Find your way again onto your backs, please. Feeling the sensations now, how your body contacts the floor. Can you sense how your bones rest beneath your muscles, beneath your skin? When you're lying here, gravity gently invites you to stay, holding you to the floor, letting the floor support every bit of you that is willing to release resistance and be supported. The opportunity to feel differences in sensations from the right side to the left side is an opportunity for clarity, not to find what is wrong, but to grow more aware, to be able to notice differences, to learn to appreciate variety. And in your own time, please roll to your side, come up to standing. And once standing, take a few moments to just feel yourself in an upright position. Feel the influences of this lesson. Find and discover just one or two things or sensations that you either can or cannot put words to, and walk around with that awareness. Let yourself be absorbed in it. And linger with it throughout the day and the week.